Okay, hello everyone, my name's Jen, I'm a children's nurse. I was also an SPSP fellow a couple of years ago, and I was lucky enough to go off to Paris, where I met this lady, Maureen Biziginano, and she talks a lot about moving away from what's the matter to what matters to you. That really got me thinking, and I went back to my ward in Paisley and thought, do I know what matters to my patients? Do we really know this? Or do we just make it up? This is not a new idea. So a very clever guy about 2,500 years ago realized that actually it was better to know the person with the disease rather than the disease a person has. On my first day back, I went into our little huddle and spoke to our doctors and said, okay, today, instead of asking what's the matter with you, ask what matters to the patients. And they all laughed at me and said, well, they'll just say, my Wii or my Nintendo or what, you know, we make things up. The truth is we make up what we think people are thinking. We do it all the time in our life, and we do it at work as well. So we asked that day what mattered to people, and none of them said my Nintendo or my Wii. They said all sorts of other things, and that confounded it for me that we didn't know what mattered to our patients, and we had to have some kind of reliable way of finding that out. So I used the improvement methodology to think about what I was trying to accomplish. And that was not to assume we know what matters to the children, but actually, here's the thing, just ask them and respond to what they say. So we had some process data, and that was measuring how many kids had actually completed a What Matters to Me, and some outcome data was patient and staff feedback questionnaires. So every child old enough to do so was given the opportunity to draw or write a poster that they put up on their cubicle door or on their bed about what mattered to them while they were in hospital. This is one of my favourite examples. I've got hundreds of these, but I love this one. It's a 12-year-old boy, Declan. Number one was no moaning. I'm really surprised. Nearly every single kid that writes one of these writes something about nurses being happy, doctors being happy, people making jokes, not moaning, not looking sad. Knock before you come in, a lot of people write that. Help me, it's slightly disturbing, but you know, it's what matters to him. Kendra is a 7-year-old wee girl that came in. She has autism. She came into York Hill Hospital, and she can't write on her own, so her and her dad did this What Matters to Me. So Kendra wrote on hers, I don't like medication in my mouth. It's a 3-man job. I'll struggle. She wrote, I'm very fast and I'll make a run for it, so watch out, ha, ha, ha. I love cuddles to reassure me. And I can dress myself, I can do high fives, and I love noisy toys. Now, the thing about Kendra was her dad was her carer, and her dad got rushed off to hospital. He collapsed in the ward, and he got rushed off to the hospital, and Kendra was left on her own. But because she had done this What Matters to Me, we knew all these things about Kendra. She wrote something else on this poster. It says, I like to touch people's hair. It's my way of saying hello. Now, if we didn't know that, if we didn't know those things about Kendra, we would think, oh, she's pulling my hair, you know, she's agitated. We wouldn't be able to get it. So because of the What Matters to Me, we were really able to look after Kendra properly in a way we wouldn't have been able to before. And the other thing is, this is above Kendra's bed. So there's a lot of staff coming in and out of hospital. So domestics, doctors, nurses, this is transparent and open. Everyone knows what matters to Kendra. You don't have to go into a file and try and find it. So how do we make a system like this reliable? This is a challenge. It is a challenge. We don't want to just ask some people what matters to them. We want to ask everyone. We want to know. I want to know that every single kid that comes into York Hill Hospital, we've asked them what matters to them, and we've listened to what matters to them. So we started collecting some process data, and that's, as I said, it's data where the people have filled in of what matters to me, and this is a percentage out of those that could fill in of what matters to me but didn't. And I'll talk more about this data at the breakout session this afternoon. We also got some feedback data, so some children feedback things like it makes them feel safe, they don't feel scared when they've got a What Matters to Me. One 13-year-old said, I have got communication difficulties and it's good to let other people know what matters to me. Parents have said it's nice to be involved and it helps hospital staff know what topics to talk about when they're not there. It helps staff look after him when I'm not there. People are reassured. They're reassured by having a what matters to me. This is spread quite far, this kind of simple idea. So people are taking it up in parts of England, Australia, America, Belfast, not just for paediatrics, but for labour suites, for neurology wards, for hospice care in adults, and for children in the community in sort of learning disability schools and places like that. There's one place in Glasgow, a lead nurse called Geraldine Marsh came over and visited us at York Hill and went back and thought, wait a minute, if Jen can do that there, I can do it here. So she's got quite a few older people's wards, and she introduced the What Matters to Me. So they did the same idea, big posters behind their bed. And she told me a story of one lady called Rose. So Rose was agitated. She kept trying to get up out of her bed. She was really, really agitated, and she had to have a one-to-one nurse looking after her because she was so agitated. And when they did a What Matters to Me with her niece and her niece said, well, one of the things that really matters to Rose is she likes to hold on to her rosary beads, and if she's not holding on to them, she has to see them. She always has to have them in her vision. And then the nurses thought, oh, right, okay, because being nurses, we are always cleaning things away. So cleaning the locker and putting the rosary beads in the drawer, that's where they were. So after that, they were able to always have the rosary beads in Rosie's hand or on the locker where she could see it. And after that, Rose became less agitated. She calmed down. She didn't need a one-to-one anymore. She didn't try and get out of bed all the time. She was calmer because we're listening to what matters to her. And I'll tell you the story about Rio de Janeiro. In fact, Geraldine will tell you that if you come to the breakout session. So my message is, wherever you work, you can ask what matters, listen to what matters, and do what matters. And one of Geraldine's staff said it really made her stop seeing the patient and start seeing the person. Thank you very much.